I am Antonio Uccelli, and I'm professor of neurology at the University of Genova, Italy. And I've been working in multiple sclerosis and neuroimmunology since the last 25 years, doing clinical work and research. The most important prognostic indicators are certainly age and the type of onset and symptoms at onset, and a number of MRI markers that can be particularly relevant to predict the outcome of disease. And however, I think one of the major issue we are still missing is the availability of biomarkers that are fluid biomarkers mainly, that are probably those things that we may really need to tailor treatments for MS patients. I think it's becoming more and more challenging try to put together all these informations at the disease onset or along the clinical history of the patient in order to have a clear picture of where the patient is going. And this is particularly important because at this stage the choice of a therapy, due to the fact that we have more and more effective treatments, but at the same time with a number of potential adverse events, it's making very, very important to try to take advantage of these prognostic factors. I think we tend to group aspects, clinical aspects and MRI aspects, and even biological aspects that we can, for example, obtain from CSF analysis in order to try to have a clearer picture of what's going to happen to our patient. And I think that there are now good enough informations to at least to a certain level to predict how these patients will go. And once again, I think that I would consider clinical factors such as age and sex. As I said, the type of onset, for example, when patient starts with cerebellar symptoms or with multifunctional, the involvement of different functional systems, this is usually something that it's a very poor prognostic factor. And together with MRI data, considering the burden of disease in terms of number of lesions and number of gadolinium lesions and number of T2 lesions and the presence of black holes at the onset of disease. All these can really give us a flavor of how disease is going to go over time. No, I think it has been basically our polar star, I would say, in the last 10 years or so or more. Definitely we have now more and more indicators that can be utilized, and scores can be utilized to predict how patients go. And also the possibility of using non-conventional techniques is becoming more and more important. Although, however, at this stage, this is not yet, except for research purposes, something that can be utilized on a daily basis. However, as I said before, I think information is coming from the number of T2 lesions or the number of gadolinium lesions, but also, for example, a new issue that became very relevant in the last few years has been the involvement of the cortical lesions, and which is indicating that multiple sclerosis is not just a disease of the white matter, but also the gray matter, has become very, very, very relevant. And the presence of cortical lesions has become a prognostic factor quite important. The area that made us more disappointed was the negative results from the clinical trial on primary progressive multiple sclerosis, which is going to be presented over the Academy, and which unfortunately did not lead to any successful result. And this is particularly disappointing because primary progressive multiple sclerosis is still an orphan an orphan kind of type of MS, so I would say it's an orphan disease, and which is disappointingly without any treatment. So that was pretty bad. I think one of the biggest accomplishment that has been provided to the MS community this year was the new classification of multiple sclerosis. I think this is something that is going to be extremely helpful for treating multiple sclerosis patients, and also for example, helping building up properly clinical trials and recruiting patients for clinical trials. And I think the effort was particularly important because it helped us to focus on a few concepts such as disease activity or disease progression. And the whole classification, in my mind, is much simpler and is more associated with biological events occurring across disease more than more clinical aspects, which are important but probably not useful when we need to take into consideration factors that will lead us in therapeutic decisions.